Last week, for those who were able to join us, we had a good webinar where we talked about how COVID exposed the deadly problems in the way healthcare is provided and the way patients access care. We talked about the fear of exposure means more patients now stay home and don't seek the care they need, reducing already thin razor thin margins, viability, and sustainability. We talked with an urgent care earlier today who told us they're experiencing that very thing, and that telemedicine is the solution. But like they said, and we talked about last week, a simple video call does not replace a thorough exam or address systematic issues throughout the patient-provider experience. Last week, we talked about adding artificial intelligence and augmented reality to telemedicine. Today, we will dive deeper in using a real-world healthcare success story, the ACOS AdviNow partnership. We have two excellent speakers today. I'll start off by introducing them. Dr. Kishlay Anand is the founder and chief executive officer of ACOS. Dr. Anand is a board-certified cardiologist and electrophysiologist and the founder of ACOS. Dr. Anand garnered extensive administrative experience serving as chairman of InstaMed Health Center, an innovative healthcare delivery model with urgent care and primary care centers in the Phoenix metropolitan area that provided lab, radiology, and diagnostics all at one convenient location. He is president of Arizona Cardiovascular Institute, a cardiac-specific surgery center with Joint Commission and Medicare certifications. He is also a board member at Cardiovascular Consultants, the largest integrated cardiovascular group in the Phoenix metropolitan area. Dr. Anand graduated from the All India Institute of Medical Sciences in New Delhi, India. He earned a master's degree in epidemiology at Columbia University in New York and went on to complete an internal medicine residency and cardiology fellowship at Creighton University in Nebraska, followed by a cardiac electrophysiology fellowship at the University of California in San Diego. Our second speaker today will be James Bates, the Chief Executive Officer and founder of AdviNow Medical. James is a seasoned technology executive with over 20 years of experience inventing and managing the development of revolutionary products with leading companies. Among his startup successes is Silicon Labs, where he was vice president of Asian operations. As founder of the Silicon Labs Asian organization, James built the infrastructure that enabled growth from near $0 to over $300 million in revenue while delivering technology that shrunk mobile phones to fit into a human hand. Among his large business management successes is NXP, formerly known as Freescale, where James was an officer and senior vice president. He took over the distressed analog and sensor group with nearly $1 billion in revenue and 800 employees. Over his tenure, the group enjoyed a turnaround that dramatically increased gross margin, revenue, and EBITDA, while transitioning to the clear market leader that delivered the technological innovations that have enabled self-driving and electric vehicles. James is fluent in Japanese and holds a master's degree in electrical engineering from Brigham Young University. With that, I will turn it over to James.
Thank you, Robert. I really appreciate setting up this webinar and having the opportunity to speak with Kishlay today. Kishlay is a long-term friend. I have known him now for going on 4 years, and we've been partners for 2.5 years. Kishlay, you've been in the medical field for quite some time. In fact, when I hear about ACOS, or I look up Kishlay Anand, I hear about cardiology centers as well as medical centers in the West Valley. Can you give us a little bit about your history and how you ended up where you are now?
No, thank you, James, first of all, for hosting this webinar. And thank you all for joining us in this hopefully informational webinar, which we are hosting. And so my journey started, as you know, James grew up in India, moved to United States, and basically being a physician, we are exposed to the disparities in healthcare and how broken our healthcare system is. And this is a global phenomenon. This is not US specific. This is healthcare is broken today. And healthcare is the slowest to adopt technology. And being a physician, we see it each and every day, the challenges we face in healthcare. The philosophy which has driven me so far is to make healthcare affordable and convenient. And that has been the driving principle behind all my endeavors. So as you know, I was a cardiologist and trained electrophysiologist. And traditionally, most of the procedures were done in a high cost center, which could be safely done in our ambulatory setting. So we basically set up the first hybrid OBL ASC in Phoenix Metropolitan, where we safely migrated all these procedures from high cost center to a low cost center, and being able to do at 50% savings to the healthcare system overall. And similarly, when we are looking at the future of healthcare delivery, we saw that the healthcare is moving ambulatory space. Healthcare is moving at home, near home. And we saw 3.5 years ago when we founded ACOS, we saw that telehealth is going to be the future to be part of the care continuum. It has to be integrated as part of the ambulatory care strategy. And it was a soft adoption, but we saw the technology aspect was coming together, the regulatory aspect was coming together, and the timing was super. So we initiated ACOS with the vision to be able to deliver care at home, near home, deliver care with primary care and ancillary. So idea was to touch member in all aspect ambulatory.
Yeah, so starting out in cardiology where, everyone would imagine that you make money, but moving over to primary care and urgent care, man, that's a tough business. The margins are completely different. It's kind of crazy that you chose to go after that. Why is urgent care and primary care so important for the care continuum?
And we all know primary as a gatekeeper mechanism works. If you want to cost contain and you want to have a value-based environment, you have to focus on increasing access point in the community. As you know, currently there is a big disparity in healthcare services utilization, and there's a lot of healthcare being utilized at high cost center. When I say that, we have overutilization of our emergency department, and that has led to the basically urgent care popping up. But urgent care does not provide the care continuum and ongoing care management. So these are more episode based. So truly, for a healthy healthcare delivery care continuum, you should have access point around preventive, secondary prevention, wellness, and chronic all combined. And that's where the ACOS model is, an integrated care delivery model, integrated with starting the healthcare journey at home, bringing with the ACOS MedClinic care near home, to urgent cares, to primary care.
So it sounds like it is extremely important for us to be able to see the doctor when and where we need to. Well, the cost of doing that manually is extremely high. ACOS has implemented artificial intelligence to help solve that problem. Kind of talk through why artificial intelligence was important for the implementation of the ACOS system.
Now, as we all know, our nation is facing significant shortage of physicians, and there's a significant physician basically burnout happening just because physicians are being overburdened by just pure sheer documentation. As a physician, now when I see a patient, all I have to do is look at a screen and type. There's no patient engagement, no good rapport building. So definitely when we are looking to create a future of care delivery in Arizona, we had to lean on technology and utilize technology to basically have providers work at the top of their license, bend the cost curve, and truly use technology in an efficient way to bend the cost curve. So what we found, which was a great partnership with AdviNow, that we could use AI and AR to standardize care, make care more efficient, and truly basically, have physician work at the top of their license. And with the ACOS care journey starting at home, we were able to use technology to triage care at the most appropriate location. If people have something simple, we can deliver care at home. If they have something where they need heart sounds, lung sounds, so without doing teleguessing where we are just overprescribing antibiotics, we are able to bring them to a nearby ACOS MedClinic, where we have now ability to really look into their ears, so have a thorough physical exam, have the vitals, have the needed labs to make accurate diagnosis. And that's one piece, as we discuss always, is missing currently. Telehealth is not, it's not all. So basically it has a value for certain population, and definitely but there's another population where you need to have some diagnostics, and that's where the ACOS MedClinic fits in. And so far in the retail model, when you start putting a provider at each location, there's no sustainability. And that's why we have seen all the retail model fail or getting subsidized through one of the other verticals in the business line. And what we were able to build using technology was truly a robust, sustainable platform for care delivery, grow the access point, whether it's an urban or rural environment, and at the same time be cost efficient and sustainable.
Yeah, I mean, most people, when they hear artificial intelligence, they've been hearing it so often that we used to think about a Terminator, coming out and attacking the human race. But now I think most people don't even know really what artificial intelligence actually means when it's used. Let's kind of go through one of the examples that ACOS Med Clinic ACOS uses as we're just talking through this example. When you start with registration anywhere, that means that basically you can start from home, you can start in the park, you can start in your office, it doesn't matter. That is where you first engage with those healthcare professionals, but you do so through an artificial intelligence engagement platform. This platform will collect all of the information that a provider will need later, but at the same time, it is triaging the patient to the most appropriate care. ACOS has 6 different potential options from a triage perspective, everything from ACOS contagious disease testing centers for COVID, all the way down to augmented reality clinics and partnerships with Safeway Albertsons or seeing physicians in person. Kishlay, why don't you talk about this triage and how important it is for your clientele?
Yeah. As we emphasize currently, there is overutilization of emergency department. The COVID pandemic did bring an opportunity for us, which allowed us to basically highlight this truly integrated model where we could start the initial triage at home. And people who are definitely, like all of us, were concerned. We have young kids in the house. There are a lot of questions. So what we allowed using telemedicine and access at home to start the patient journey, using a AI-enabled chatbot to get the initial questionnaire asked and then connect to a provider for any further care discussion. And we had, with our clinical team, we created a care pathway where we could, if they had something, just simple questions, we answer them and allay their anxiety and keep them safe at home. If they have something where it need to do a testing, we were able to guide them and pre-register them to do a testing at one of our facilities, which was or if they had something going severe, if they had respiratory issues, then we were able to initiate 911 and kind of guide that process. So definitely you can see how technology combined with telehealth and integrated in the care delivery model fits in very well in terms of directing care to the most appropriate level of care. So that's where I see that this model has the biggest value. This definitely disperses the care across the spectrum instead of overburdening emergency department, and has been very valuable with the COVID crisis.
So as a patient, many might be a little bit afraid of engaging with an AI. Again, visions of Terminator still are kind of out there. So let's kind of walk through what a patient journey looks like, and then we'll hear actual patient feedback and provider commentary from Dr. Anand. When you go through this process, the patient begins their journey on their smartphone or on a tablet or a computer. Really, it is a device agnostic engagement to the healthcare platform. It is just a link that the patient would click on, and they would go through the whole registration and triage process and they are told exactly where to go based off of their condition and the requirements for measurements. If measurements are not required, they will have a visit starting right at home. If measurements are required, then there's a couple of options that they have. One is they can have an at-home kit partnering with the ACOS implementation where they can do those measurements right at home. Or they can come into one of the partnerships with Safeway for a more in-depth lab, as well as ear and lung exam type of examination using the augmented reality platform. Providers are not in these locations, but through the augmented reality platform, exact medical measurements can be taken that will give providers all the information they need to make sure that they're not overprescribing antibiotics and they are treating patients to an objective analysis of the situation. The next step is once the AI is collected, all the information the provider will need, it gives a summary to the provider, a list of potential illnesses, as well as all of the objective, which means the measurements or labs, and subjective, which is the questions that the patient answered, information that is required in order for the physician to make that third-party analysis that, yes, using my medical expertise, this is the right diagnosis and treatment plan. At that point, the provider, whether it's over telemedicine or whether it's in person, gives the summary to the patient and confidence that they are treating them to the fullest extent of not only the illness situation, but also the provider capability. So as your providers and patients have been using the system, what type of experiences or feedback have they had?
Yeah. So when we look at healthcare, to be significant in healthcare, we say you need to be touching 3 Ps: patient, physicians, and payers. So I'm going to basically go to each of these segments and kind of talk the experience which we have had working the ACOS Med Clinic model in the care continuum. So on the patient side, again, the convenience which it brings to a mother with 3 kids to allow the healthcare journey at home, get the care at home or near home, is very valuable. Before that, they had to go to the urgent care emergency department, wait for a few hours. Now they're able to have access to care at home, near home. Very valuable. And the testament to that is in all our Google reviews and patient testimonials, which we have received over time. And definitely there's a learning curve, but the technology adoption is very fast, is very simple, very intuitive, and that has really given a good user experience on our side. On physician side, talking on their side, what it allows to do is help standardize care. And currently, as we discussed, there's a significant physician burnout. So what the system allows is also auto documentation, auto scribe, and also uses evidence-based medicine to support clinical decision-making. So what we have found in our experience is that there's a disparity in healthcare, and some of that is driven by the providers. And now using technology to standardize the care delivery and augment the physician decision-making is a significant component of value to even physicians. Now, basically, all you're doing is engaging with the platform has already created your document, it's already helping you create a care plan, and it's basically now you're able to truly work at the top of your license. You're not doing the clerical work anymore. Or with a simple click, you're able to send a prescription out. And then also the system automatically generates follow-ups. So we feel on the physician side, we have seen a significant satisfaction, and our physician will attest that working with the system, they are more productive, they can see more patients, and they're highly efficient. And then going on the truly in terms of the payer side, which is the healthcare delivery cost, definitely using this model helps decrease utilization of emergency department. We have done actual studies to show there's a significant savings created by this model and access to care created in urban as well as rural communities.
Absolutely. I mean, as you're going through, as Dr. Anand mentioned, a big portion of the AdviNow platform is that we actually collect all of that information and populate it directly into the EMR, where greater than 70% of the electronic medical record or electronic healthcare record is pre-completed for the provider. And the provider, with just a few simple clicks, can get the auto-scribed note complete and move on to the next patient. That enables 2 to 3 times more patients that can be seen, while the patient face-to-face time with the provider is either the same or longer for the patients that really need it. This platform has enabled revolutionary access through the ACOS network, at the same time allowing one doctor to see as many as 10 patients per hour as we've seen in the ACOS Med clinics, while still having 94% patient satisfaction numbers coming through that engagement. This high level of patient satisfaction has really been amazing to see and revolutionary, as the truly location agnostic visit has become a reality for the ACOS network. As we move forward, there's always a profitability balancing act to manage. You know, there's as you are expanding access with the vision of providing that value-based care that ACOS has and is committed to do, that the cost of providing that care and the reimbursement that you get from payers has always been a limiting factor really to realize that vision. When you have the objective measurements and you have a complete history and providers are able to see more patients, then that profitability balancing act actually turns into a realization. When we go forward and we're looking at examples of clinics, this is an example of a clinic that had over 100 locations, and you have maybe $130 million of revenue. Combining the increased efficiency that adds a $20 million increase, and then the new retail clinics or at-home clinics, that's another $20 million of increase. What you see is the profitability skyrocketing. This rewrites the rules. As ACOS has rewritten the rules for healthcare in Arizona, this has become a realization. Kishley, how are you rewriting the rules for value-based care?
So we see that the future of healthcare is going to be more and more migrating from fee-for-service to value-based environment. And ACOS has initiated ACOS IPA. We have a pretty robust network of 250 primary care and over 2,000 specialists who are now utilizing ACOS telehealth platform and basically using the ACOS infrastructure to manage population to bend the cost curve. And what we have done is, as part of this, driving more value towards members in terms of service and access to care, and our physician partners to drive more value to them, and has been a very successful model.
So AdviNow and ACOS have had a long, successful partnership. That's probably not the only partnership that we should mention, as Safeway Albertsons has also been a fantastic partner through this journey to realize really the world's first fully automated medical visit, where you have telemedicine, you have retail clinics, you have in-person clinics that see patients in person, as well as your engagements that you're doing with employers as throughout the state. So kind of talk through not only the successful partnership we've had, but other successful partnerships that you've been able to create.
So definitely, like the ACOS Med Clinic as an on-site is a great add-on in the employer population. And as you know, our employers are faced with the significant challenge of rising healthcare cost as well as premiums. And currently for most employers, they do not have an active way to manage this cost. Once being a medium-sized employer ourselves, we know that once a year the broker will come with our premium raise, and that's the only time I get basically any visibility to my healthcare cost. And from there on, there's a clear gap. What we have done is work with broker partners and TPAs to truly take this solution of integrating telehealth with on-site clinic as an opportunity to help the bend the cost curve and bring the medical cost saving for the employers. Has been a very successful model. We have partnered with several employers in the Flagstaff area who are using our ACOS Med Clinic in Flagstaff for services to their employees. And similarly, we are taking that strategy nationwide. Currently, we have clients working in Wisconsin who want to use these on-site clinic and near-site clinic for their population. And I think this is a very robust way to provide quality care and bend the cost curve.
It's been an absolute pleasure working and knowing you, Kishley, over the past 4 years. And it's amazing to see the growth of ACOS, but that consistent vision to provide care to a population and be able to improve the health and livelihood of them. So we will move on to questions after this and pass it over to Robert. Robert, what questions have we had so far?
Well, as a reminder to everyone, there is a Q&A button on the screen. We've got a few questions that have been sent in. Feel free to submit some Q&A and we'll get to as many questions as we can. Right now, our first question comes from John, aimed at Kishley. So Kishley, the first question goes to you, and that is rural communities have and I'll add a little here, Communities need a little more healthcare. What can ACOS do to help improve healthcare in the rural communities?
Currently, the rural communities are facing a healthcare crisis, and that has been amplified in the COVID. So rural and tribal, there are two areas where the healthcare disparity is significant, and Arizona has a significant rural presence. And what the ACOS model is able to bring using telehealth as well as the ACOS Med Clinic is basically bring primary care as well as specialty, specialty care available in these communities. Currently, if you are living in a rural communities, you have to drive literally maybe for a few hours to see a specialist. That's the reality of today, which is a much higher cost, inconvenience, and using now technology as well as the ACOS platform, we are able to bring the much needed resources to the community. Like one of the tribal groups we are working with locally has a significant prevalence of diabetes, but does not have an endocrinologist. And now we are working with them to set up a diabetic clinic in partnership with local endocrinology physicians to deliver the care remotely, which will be just imagine the impact that can have in terms of outcomes by just making that small service available. And those are the things which excite us and puts the drive inside us to be able to make, again, healthcare affordable and convenient.
Thank you, Dr. Anand. Next question comes from Marco. This one is aimed towards James, and specifically on the AdviNow system. You talked a little bit about using things at home. Can you explain more about what capabilities to truly do a at-home exam for telemedicine?
Sure. So, doing medical measurements at home through Bluetooth has never really been a challenge. People have had apps that you can connect to medical devices for many years. The challenge is always, how does your doctor use that information? And when should you use it? And really, how do you know that you're using that medical device accurately? The kit that we have, we partner with a couple of medical providers that give FDA-approved medical devices that are relatively cheap. I mean, the kit that we currently have that is supported within the ACOS infrastructure is just a couple $100 to take home. And with that, you can do your temperature, weigh scale, pulse ox, blood pressure, which covers many issues. Now, we soon actually will release, coming in Q3, where on your tablet and phone, the augmented reality for not only the measurements I talked about previously, but also a lung exam or a heart exam, an ear exam, will all be available to be done on your smartphone at home. And all of that information gets populated for the provider, and it's taken when necessary. This allows the truly objective at-home visit, which will assure payers pay at the right level for the providers to treat them in this location, patient location.
Thank you for the answer, James. We'll move on to the next question. Dr. Anand, this one's back to you. Can the ACOS model be made mobile?
So ACOS model is mobile, and we have solutions which you can literally, as we discussed, now you can carry just a smartphone with your devices and be mobile. We have basically medical bags which can be taken to set up clinics. And this is a model which basically can, as I said, is platform agnostic, does not need a download. It's on Android as well as all major platforms you can use. So it is mobile, yes.
Thank you. We have a question that's come in from Larry. I'll ask a bit of this. In which countries is the ecosystem currently being used? And I think it would be more, can it be used international?
Yes, so currently we have ACOS India, which is a subsidiary. And again, as a growing country, India is facing some of the same challenges we see here in terms of rising healthcare cost. India does not have a lot of primary care infrastructure currently, and which has led to a lot of people seek healthcare once they have a heart attack. Chest pain is what initiates. There's no. So what we are working with is working with the employer population as well as corporate partners to bring that up, improve the access to care in rural community as well as in the urban community in India. So that's live. We have partnership in Middle East as well as Africa currently, where we are working majority with the employer population to create on-site solution for them. And so these are some of the current locations where ACOS is available.
Thank you. Follow on from Larry is, and James, I'll aim this towards you. Can you describe the partnership between ACOS and AdviNow?
Sure. So ACOS and AdviNow really partnered to develop this location agnostic visit together. We partnership originally within the Albertson Safeway location to set up the world's first fully really automated medical visit, kind of the concepts that we've seen. But through the partnership, we've been able to expand it across all different mediums that really Kishlay's vision is bringing to the Arizona community as well as the rest of the world. So at an extremely high level, we're a vendor, but we're definitely a lot more than a vendor. We are a partner.
Yeah. And I'll take just to add to that, basically, as you know, disruption comes when specialties intersect. So the technology coming with healthcare in this model is truly what has created this disruption and created a new contemporary way to deliver healthcare in all across the globe, basically. So definitely that's the joint partnership which we have been able to work over the years to develop and own it.
One more question has come in. This one's from Janet. And Dr. Anand, I think this was aimed towards you, is COVID testing. Do you do any COVID testing?
We are doing COVID testing currently in partnership with partners all across USA. In Arizona, we are very active doing on-site COVID testing. We have been working with Arizona Department of Health doing COVID testing with the Arizona Blitz testing initiative. And definitely that was a need of the time for the community, and our team stepped up to provide that service in front line. So yes.
And I will kind of add on a question from me on this one is, James, towards you regarding COVID and the coronavirus. Can you talk a little more about what AI can do in the coronavirus world?
Sure. So from an artificial intelligence standpoint, as I mentioned, there's subjective and objective. Obviously, we can't do the tests over AI. That's something that can only be done at a testing, facility, whether it's a clinic or a dedicated testing facility like the Blitz activity that we had here in the state of Arizona. But what we can do is create a risk profile about every patient. Now that risk profile is twofold. It's what is the probability this patient has COVID, and that's done through a questionnaire, and we within our system have the probability based off of that questionnaire on whether the patient really does have COVID. Now it needs to be confirmed by test, but that is what AI does, and it allows us to guide the patient to the most appropriate location to really know if they have it or not. The second level is that as we are engaging with the patient, we are also making a risk profile on how risk is this patient, what is the criticality of this patient catching COVID. So if this is an at-risk patient, maybe they are over the age of 70 or they have diabetes, maybe they're obese. These are some of the risk profiles that actually will put a person who catches COVID more likely to be fatal. We actually will risk profile each patient to determine whether it's safe for them to go to a location that may have COVID, and to make sure that they're either seen over telemedicine or they're in a non-COVID dedicated clinic to keep them safe. So not only do we help guide the provider, but we help guide the patient to keep both of them safe with the COVID experience.
Perfect. Thanks, James. Unless someone has a last minute question, please post it or send me a chat with it. If not, we'll move on and thank Dr. Anand for coming in today and spending some time with us this morning from a busy schedule to talk further about ACOS and his cardiology work and how it's improving healthcare, not only in the metropolitan areas, but also in the rural communities and international.
No, thank you for hosting. A pleasure, as always.
Thank you, Kishlay. Next week, what we're actually going to do is go through a real world example, walking through the engagement of what you just witnessed of ACOS engaging this, utilizing this system to provide the population of Arizona healthcare coverage. We'll actually walk through the real world experience using the platform on the patient side and the provider. So now this will completely close out how, starting from the exposed crisis within healthcare that COVID really exposed, as we talked about in our last webinar, the actual real world implementation with the ACOS network, and then actually seeing what it means to the patient and the doctors. That's next week.
That sounds like it's going to be a good one. So we'll look forward to it next week. I believe the invite for that will be going out tomorrow. Thank you everyone for joining us. Stay tuned for an email later today that will have a link to review the video from today. If you have any questions, please feel free to send them to us offline via email. The email is info@advinow.com. For that, we'll sign off. I hope everyone has a good rest of the week and a good weekend. Thank you for joining us.
Thank you very much.